What happens when a drug addict accuses a psychiatrist and an organization that provides mental health services of lying and fraud? Who do you believe, and what would you do about it? This information is especially important for members of the legal and law enforcement communities, so I hope you'll take a few minutes and watch this video and consider what's being said here. The document I'm going to go over is from a Yelp review of doctors that was written in the summer of 2021 by a woman going by the name of Denise H. I'm going to read it in its entirety here and ask you to consider who's telling the truth. So I don't have to refer to it, so I don't have to stop and refer to it. The acronym MAT, M-A-T, refers to medically assisted treatment, and Suboxone is a medication used to treat opioid addiction. Let me start this off by saying I have absolutely zero reason to lie or stretch the truth about this. I neither gain nor lose by admitting or denying anything. I'm writing this to raise attention to the behavior of someone in this clinic that I believe whoever's in charge should be aware of. I'm part of the MAT program, and I am an addict, and I have zero shame in it. It's a daily struggle, and I've been going here over a year now, and some weeks I pass my drug tests, and some weeks I do not. And I'm totally fine with taking responsibility when I slip up on occasion. I've never argued with any results, and I do not deny using ever. I am not on paper with the courts, so my sobriety is not required. It is my personal choice to be sober and take Suboxone. Long story short though, if I slip up one week, I am ready and aware that I will have a positive drug test, and like I said, I do not have shame in it. I'm okay and ready for it when it happens. With that being said though, what I do have a major problem with is popping a dirty when I have been 100% clean and behaving myself. That's not okay, and I strongly sense foul play from whoever might have collected my urine. I was so upset I actually quit the program and left family health altogether after that. If I were guilty of popping a dirty, I would never take lengths to deny. I would accept it, and the proof that seeing how I've stayed through the program countless times after pissing dirty. Common sense would tell anyone I'm speaking the truth here. I was so upset because of the fact that I've never been prouder of my staying clean as I was this time. I hadn't even been around a 20-mile radius of anyone I knew that used, so it was impossible for me to have anything in my system. I never wanted to leave the program, and trust me, it was hard to walk away from the hundreds of free milligrams of Suboxone, but in the end, I chose my dignity over them because I'd rather go without than deal with such a dirty organization. I did transfer offices at first, but found I couldn't, so that was the end of ties to FHCSD, Family Healthcare Centers of San Diego. And I'm happy to say I changed plans to Kaiser and have never been more happy or optimistic. So in a way, I'd like to thank whichever dirty employee lied and cheated to get me out of there, but so happy it happened. My first appointment at Kaiser, they were also able to diagnose something it took over 30 doctors at Family Health to never figure out. What else does that say? This place is garbage and they know it. The one cruel doctor, Sarah Ramos, you were actually great, so this excused you. Also, Savalda was okay. I just wish he would have thought harder and listened to my complaints rather than say it was a delusion. So that's the post she made publicly. Let me take a few minutes now, or a minute, just to summarize what I see some of the major points are that she made. She says she has zero reason to stretch the truth, and that her reason for posting is to raise attention that somebody in the clinic is doing something she considers to be dishonest, and that whoever's in charge, the person in charge of that organization, Family Healthcare Centers of San Diego, should be aware of it. She says she's part of the MAT program, and she freely admits that she's a drug addict, and she says she has zero shame in it, and she's working on resolving it. She also lets us know that she has failed drug tests, apparently several times, and she says that when it happens, she always admits that she did use drugs that week. She also says has nothing to do with this courts. This is not a court-ordered program in any way. She's doing it voluntarily for her own sobriety, and it's a personal choice that she stay sober and take this this medication, which apparently reduces opioid cravings. Then she goes on to say, however, this one time, she adamantly denies that she had used any kind of illegal drug the week before. And she's very adamant about it. And she was so upset that she quit the program. She walked out, apparently. She says that if she were guilty, she would admit it. But this time she again adamantly claims she was not. She says she was not within a 20-mile radius of anyone. She even knew who took drugs. And she said it was hard to walk away from the medication she was getting that prevented her from taking opioids. So that's a problem that she did walk away from it. But in the end, she says she chose my dignity over them because she'd rather go without them to work with what she calls a dirty organization. She's calling Family Healthcare Centers of San Diego one of the biggest private clinics, government-funded clinics in the San Diego. She's openly accusing them of being a dirty organization, and she is a drug addict. She's a junkie. What else did she say here? She then went on to, she got to Kaiser, and it worked out for her. She says she's happy and optimistic. That's certainly good news. And she's actually thanking the person who lied, who she believes lied, saying that without that happening, she never would have gotten the help she needed. And that she's also saying they diagnosed something that over 30 doctors, she's probably exaggerating there, but it took a number of doctors at Family Healthcare Centers of San Diego, never diagnosed. That might be one of the underlying causes of her drug addiction. We don't know. She doesn't say, but that's a possibility. She says that Family Healthcare Centers of San Diego is garbage, and she says they know it. She compliments one doctor, Sarah Ramos, who apparently did try to help her. And she says Dr. Sepulveda, his name is Joe Sepulveda, was okay, but he did call her delusional. So those are the facts of the case right there. So the question is simple. There's a junkie here, an admitted drug addict, uses illegal drugs, who has failed the drug test, and she is calling out the organization and Dr. Sepulveda, essentially calling them liars and saying fraud or some kind of criminal activity is going on there. So the question is simple. Who do you believe? So with those facts, I hope you've taken a moment or two to consider it and form an opinion. There's only one truth here. Either she was using drugs the week before or she was not using illegal drugs the week before. So who do you believe? Do you believe the organization and the psychiatrist at Family Healthcare Centers of San Diego? Or do you believe the admitted drug addict? I'll tell you what I believe. I believe the junkie. I believe this woman is telling the truth, and I believe she's telling the whole truth. I don't believe she used drugs at all the week before. I believe either those drug tests were wrong or somebody altered it. And I believe this woman got lucky that she found Kaiser. Maybe other people didn't get lucky. But I had a little bit more information available than you might have looking at this. It still is a lesson on keeping an open mind, but I was a patient. I really hate that word, but yes, a patient at Family Healthcare Centers of San Diego for over 9 years. And I also had direct experience with their mental health group, specifically Joe Sepulveda. She talks about at the very end of this message. He's a pathological liar. That man fraudulently claimed to have been my psychiatrist, and I have never met him. I had a 10-minute online non-consensual meeting with him that was supposed to only be discussing continuity of care, and I wrote a letter prior to that meeting making that clear. This was non-consensual. They do not believe in consensual care at all. I totally believe this woman is telling the truth. But a few other things we need to pay attention to here. First of all, it's a horrible assumption believing that drug tests are always correct. I have an undergraduate degree in microbiology and public health. I didn't use it much. I worked in labs a few years after college. It wasn't for me. Went on and got a graduate degree in public policy related field. But tests get screwed up all the time. I personally have screwed up drug tests looking for contamination in drugs. It's ridiculous to assume they're right. Why didn't they order another test? That is, something is seriously wrong with these people. We also need to be aware that these drug testing companies are in a dirty business. Here's an example of one that happened right here in San Diego just a few years ago, where they ripped off the government for more than $3 million. This was almost exclusive, or I think it was exclusively for forced urine testing. I refuse to call it drug testing, that euphemistic name. They're not testing drugs, they're testing urine, and they're forcing people to take urine testing, about the most degrading thing that you could possibly do. And it's not necessarily drug addicts at all. One of my disputes, one of many, with Family Healthcare Centers of San Diego, I was suddenly ordered to undergo this forced urine testing by Joe Sepulveda. He has based his entire career on forced urine testing. In this case, and this I think is significant, it wasn't one of the people forced to take these unnecessary urine tests who got them in trouble, because the system will not even listen to them. Once you've asked for any kind of mental health that requires medication, in their worldview, or in the worldview of many in this profession, you're considered to be a drug addict. But who finally got them was not one of the people that complained, because again, they don't listen to them, one of the victims. It was an employee, and he ended up getting, how much? $300,000 or something? They paid $517,000 for reporting it. Meanwhile, all the victims got nothing, except possibly got their life ruined. So this is something we need to pay serious attention to. I'm going to want to know from the San Diego courts exactly how big this forced urine testing industry has gotten here in San Diego, because it is truly disgusting. She also says that Kaiser found something else wrong with her. She mentioned that she had been to a number of doctors there, and they didn't figure out what was wrong. That could have been an underlying cause of her drug addiction. We don't know. I already know the guy she's talking about, Sepulveda, is a liar. He used that same word, delusional, about me. He says that I am paranoid and delusional for believing my mental health care providers are conspiring against me. And Myra Booby Sepulveda, apparently they're not related. The director of mental health said more or less the same thing, that I couldn't accept the gentle care I was getting from these people. These people are liars, and Family Healthcare Centers, as she says, is a dirty organization. It's a criminal organization. At one time, it was a mediocre but acceptable community clinic. Over time, it became nothing more than a Medi-Cal billing mill. Medical fraud everywhere, billing fraud everywhere. You can't swing a dead cat at Family Healthcare Centers of San Diego without hitting billing fraud. As she says, they're a dirty organization. She's absolutely right. She's telling the truth. You know, and I sense something else from this, and it's kind of not concrete, but I really sense just immense courage in writing this. It took a lot of energy to write something like this, because I've written a lot of these and they just get ignored. A lot of people have. A lot of people have tried to sound the alarm about what Family Healthcare Centers of San Diego is doing to our community. But I sense leadership and courage in this. And gosh, I hope she gets the help she needs. And we really have to compliment Kaiser for helping her. And it sounds like they have. But there's one more important thing we have to consider here, and it's really, really important. Everybody has their superpower, something they're good at that other people aren't good at. For me, it's what I call seeing what isn't there. Now, that's not in the schizophrenic sense, because I know how much these people love making up fabricated diagnosis. They fabricated at least a half dozen. Joel Sepulveda, who is now their head of psychiatry, fabricated at least a half dozen dangerous sounding psychiatric diagnosis for me, and submitted those to the San Diego court system. So this man is really a liar. But what we can't see here is The uniqueness of this woman, she had the courage to write this up. Must have taken tremendous courage to be honest and express this opinion. What about the people who didn't? What about the people who they flushed down the toilet? Um, this could have easily gone in the other direction, where she got kicked off the program after being clean, went back to using drugs instead of, as she did, getting help. She was lucky. She was lucky help was even available. Um, but someone else might not have had those options. I didn't have the options when I got kicked out of the program. They'll just kick you out on the streets. They don't care. I want to emphasize, there are good people in that organization, but not at the lower levels. So they only promote people who are very exploitive. They call it doing the numbers. Um, but at any rate, she might just be the tip of the iceberg. This might have happened to a huge number of people, and a lot of them might have overdosed. Some of them might have overdosed, some of them might have committed suicide. We don't know. We should do a study and find out. Anyway, I want to thank you for listening to this video and paying attention to it. Uh, I do think it's an important issue we need to look at. We need to find a way to warn the community about Family Healthcare Centers of San Diego and the way people like this operate. Thanks for listening and thanks for your attention.